Good day. In continuation of the series, we'll be talking about how artificial intelligence can help healthcare improvements from the patient side and also from the giver side, that is the healthcare professionals. As usual, the presentations will be very brief, and whenever I talk about AI, I try my best to straddle it with a particular clinical scenario. Otherwise, it makes not much of comprehension to just throw theory in the air. And the clinical image and scenarios are from my personal collection and patients have consented. So now, you're talking about AI in trauma rehabilitation. What happens? You can apply AI in the pre-hospital phase itself, or in your clinical decision making, in your introp, in your imaging comprehension. You can decide about discharge preparedness. The problem is when they are discharged home, you can also apply the AI, because the recovery, the treatment, albeit not very acute treatment, the treatment can be handled by the caregivers, by the patient themselves and the community. But that treatment part also can be handled much better by the AI, because it's a sort of very step down part of the recovery which can be easily given to the AI but with the human in the loop. Okay, now this is a particular scenario. Patients treated many years ago. Let's have a look. This patient is a post-head injury sequelae. He is in a vegetative state and he needs feeds. He cannot feed himself. So what would happen? We would train the healthcare worker. You can see this, as I told you, you can see the Rice tube there. We will tell them to hold it up. We'll give them a lot of instructions. Fair enough. The recovery will continue in the house. Now, the whole thing is on the caregiver now. Fine. And the healthcare worker, for them to sit and monitor this process which is happening in the home now. It's no more in the hospital. Instructions have been given and patient has been discharged home. For a healthcare personnel to give these instructions to the caregiver and also to monitor this patient, to keep on monitoring what's going on, is very difficult. It is not possible. So how can AI come into this picture? You bring the AI here. What does it do? It can monitor this patient, of course, with wearable devices. It cannot just monitor like that from the air. There are wearable devices which will be giving feedbacks. It can monitor the patient and also give instructions to the caregiver saying this is feeding time. Or there are devices which can tell when the patient is mouth opening. That means they are hungry. So she can feed on demand. Lot of things regarding the calories that are going in every day. A whole lot of things can be incorporated into this algorithm. Now, it's not as if AI will be independently acting with these two stakeholders. It will be constantly interacting with the healthcare personnel and flagging issues. Now, the healthcare person can decide that he is going to uh, reiterate the AI for this particular patient, for that particular need at that time, or so bringing up for follow-up needs a lot of time, effort, and money. So you sort of monitoring them from the house. So is AI going to help the caregiver and the patient and the healthcare professional? Yes, it is going to. It can be used to, as I told you, monitor remotely. I've told you all this. It's just a summary. And if you feel the healthcare worker can call for a physical follow-up, and the AI can also fix an appointment for that. So now this is putting everything together. I know the slide is jam-packed, but there's a lot of information in this slide. Let's have a look. The main thing is nutritional calculation. Now what happens when you're manually trying to get the nutritional calculation? You have to feed in all these characters. But AI will go and take these basic parameters from the record itself and calculate. So that part, the healthcare worker is freed of doing that mathematical calculation. As I told you, there is automated monitoring. Wearable devices, they will even tell you whether the tube is blocked or patient is uncomfortable because there is a camera sensor also. And these are done with Internet of Things. What exactly is the algorithm used or the tool used? It's Internet of Things. There can be personalized recommendations. For example, they found the blood sugar high. Nowadays, they can do the blood sugar through a wearable device. And if the blood sugar is high, it will tell the healthcare worker the blood sugar is high. Maybe we need to handle the sugars now. That is done by machine learning tools. Real-time feedback. How about the nutritional status? Is he getting enough fluids? Is he getting enough trace elements? All those things can be factored in. So what is the end result? It reduces the risk of malnutrition. Whereas if you're going to remotely control or throw him just into the community to handle all the problems himself, it is not going to give the best outcomes. So with the AI in place, and of course AI just cannot come from the air, it needs a lot of infrastructure and the particular apps also. You can reduce the risk of malnutrition, you can ensure patient safety, and there is increased efficiency. Many patients who go home, they suddenly die. That's because of the aspiration and wrong feeding practices. These things can be mitigated by implementing AI in this loop. So now you may be asking me, is there an app for nutrition? Yes, it has been launched by the ICMR and it's available in 75 languages. There are some AI apps like Imitin. It's being deployed in some hospitals, but I was not able to get I tried my best. I was not able to get the website or the screenshot of the app. So that is all for today. Thank you all very much. As usual, it's brief, but I just tried to take one particular care gap and see how well an AI can fit in. Otherwise, it will be just theory of AI. We're just trying to fit in small gaps. And this is on behalf of the company Dogstripe AI, for which I'm the subject matter expert. And I do appeal, please like and share and repost. Not only that, please comment. The moment you comment, I am forced to answer. If I don't know the answer, I am forced to go and look up for the answer. So thank you all very much for your support.